So as of today, we have 485 confirmed cases in Ingham County, 13 reported deaths, one more death reported today, and the other one was yesterday, but it was late yesterday, so it didn't get on your counts yesterday. We have 8 people in the hospital, 3 of those in ICU. The rest are home outpatient. So we're showing a case fatality rate of 2.7%. Understand, please, that's basically based on those who are tested and doesn't completely account for all of the cases that probably didn't get tested. We continue to monitor folks who are exposed or have travel or other known risk or contact, and currently 256 of those are active and 464 are complete. So basically, we also have 155 folks recovered out of those 485 cases. Our daily incidence curve looks kind of like this. I'll be showing you in a minute. We're going to start to do some rolling averages on that because it helps smooth out these lines, because as you can see, if you can see my mouse, we kind of bounce all over the place, but we kind of look like we have a downward trend this week. This is basically a % positive tests per day. I think I talked to you about that. As we increase testing, we've got to start looking at, and on any given day, you know, we have increased numbers of positives, but is part of that due to increased testing? So here's a graph that kind of shows you that. This happens to be Clinton, Eaton, and Ingham counties. So this is a rolling average for the 3 counties in daily incidents, and the line that you see over that is also a rolling average of positive tests per day. And you can see this nice downward trend of us testing people and how many of those folks come out positive every day. And you can see that % positivity high comes right along with the high in our number of cases per day. So that's also a good trend line to be watching. The other thing I kind of like to look at here is our hospitalizations as another indicator of kind of where we were and where we're heading. So I didn't have data before April 5th as I threw this together today, but you can see that we were, you know, bouncing around in there around 25, just a little under, just a little over 25 folks in the hospital per day, 5, 6, 7 of those in the ICU. And then as of the 23rd or so of April, those numbers started gradually going down with, I guess, a little blip yesterday. Some people must have gone into the hospital yesterday and then come right back out, or who knows. But anyway, you can see that gradual trend downward in hospitalizations, which means the work that we're doing to prevent those serious cases from dying is working, which is part of the whole flatten the curve goal. So this is our cumulative counts, which will just eventually flatten off for us as we continue along. So you'll see that just kind of continue to flatten out a little bit as we continue going along, so long as case numbers continue to flatten out. And then here are our zip codes. So in 48911, we're in the 121 to 130 range with numbers of cases. And then our next highest range of cases is Mason and is that Mason? No, East Lansing. And 48910 in Lansing.
Hey, Linda, your screen's not moving at all.
It's not?
No.
It's moving for me. Oh, your screen is paused. Okay. Hold on. Hang on just a minute. Let's share again and see if that fixes it. Okay. Is that paused still? Are we better?
Good.
Okay. Thank you for letting me know that. Okay, so here we are. How far back do I need to go?
At least to the zip codes for me, please.
Oh, zip codes, there you go. So 48911, followed by way on down 48823, 48911, and 48854, which is Mason. So that looks like this on a map of cases by zip code. And remember, I keep talking to you about rates. We have vastly different population counts in those zip codes. And so if you look at it by rate, we do pull in the Mason zip code as well as a high rate area, and still down there in the Onondaga area. We are now 49% male and 51% female in terms of our cases by sex. And then our age groups continue to be that 50 to 59 group, but really we're just plateauing out with everybody from 20 up to 59, kind of in that same 15, 16, 17% of our cases distributed across those age groups. By race, we're 51% Caucasian, 26% Black or African American, 14% Asian, and then other. Again, we look at this by rate, and what we see is 114 per 100,000 for Caucasians, 376 for African Americans, 357 for Asians, and then our other category again there. So we are still trending at 3 times the rate for African Americans, as well as, you know, getting in that area for Asians as well in terms of incidence, rate-specific prevalence. We are, as I told you, getting lower and lower numbers in the hospital. So we are now 98% of our current cases at home and 2% hospitalized. If we look at the status of all of them, rather than just home versus hospitalized, we see that we have just 1% in ICU, 32% recovered, a going on 3% fatality rate, and 64% home. And that is today's data. So I know that a lot of you may have just seen part of the governor's press conference. She had a town hall last night, her press conference earlier this week as well. And a lot of the conversation is, I think, buzzword of the year, pivoting to strategies for reopening and what it looks like to allow us to reopen, as well as what the reopening looks like. And our Regional Chamber of Commerce has been a great partner and great in communicating with all of us, and has been communicating with businesses across the region about reopening strategies and health concerns. And I've invited Mr. Damon here to talk to you about some of the initiatives that are going on through the Chamber with regard to businesses and impact and how they intend to move forward. So thank you, Tim.
Well, Linda, thank you for the opportunity to join you today and discuss kind of the impact of businesses, but I think, as you said there, kind of how we start planning this, what we're calling a smart relaunch of our regional economy. My team earlier today reminded me that we just finished our 7th week of working remotely, and you know, we've learned a lot along the way, and probably made a few mistakes there as well. But and it's just interesting, and looking even at hosting all of these meetings via Zoom, we probably didn't even realize existed 2 months ago. But you know, I think it goes without saying that the extreme disruption that COVID-19's had and continues to have in our regional, state, and global economies is unprecedented. And you know, we've certainly relied on several business surveys, I think, to gain a little bit more accurate and ongoing assessment and impact regarding needs of our Lansing regional business community, and has been extremely helpful, I think, in how we've kind of positioned ourselves and how we communicate and advocate and talk regarding policy and different strategies, I think, in supporting and representing our region to state and federal leaders. So you know, when we looked at the early phase of this, I think it still holds true today that the biggest impact and challenge to businesses has been and continues to be that cash flow, the payroll, and the access to capital. You know, there's a lot of concern right now too, I think, on the employee side, the furloughs and layoffs that have continued to occur. I think that the most recent numbers statewide are 1.3 million Michigan residents have filed for unemployment. The business closures, just the number of businesses who are just not open or able to sustain operations right now. And then those supply chain concerns, and what do those supply chains look like now? But more importantly, what are they going to look like as we begin to emerge from here? So when we ask them sort of the biggest challenges and what they're going to be and the barriers to reopening, it's retaining customers and understanding what's going to happen in their customer base as well. So a business may be prepared to go back to work, have the employees to go back to work, but what is that customer base going to look like? And I think that's some of the unknown. And when you hear people talk about this ripple effect in the economy and the long term that this is going to probably watch us emerge from here, something we need to continue to monitor. Cash flow continues to be there as well when we look at those challenges. implementing the new health protocols. We've talked a lot about that and what's that going to look like for the employers as they continue to provide a safe and healthy workplace for their employees and customers. Bringing back employees, the supply chain again, and then ramping up to meet some of those expected demands. I think there will be some pent-up demands in certain areas of our economy, and what and how our business is going to be able to ramp up to meet those demands. You know, I've mentioned cash flow several times, and as we look at addressing the cash flows, probably the biggest piece here has been the Paycheck Protection Program. I think through phase 1 and phase 2, there's been over $660 billion that's been available for small business loans. As of last Friday, April 24th, through our membership, we had indications that about 25% of those that had applied for loans were successful in receiving the loans. 31% were still waiting, and I think that a few more of those came through, through this week, and obviously phase 2 did launch and open up. While we're not able to break down the data on a regional level, we do know that our financial institutions here were very active and very successful. We found a lot of the smaller community banks to be the ones that were pretty successful in navigating and helping businesses, access and process the loan process there. But when we look at statewide, I think statewide businesses, we had over 43,000 businesses that were successful in receiving loans totaling $10.3 billion. And so when you start breaking that down nationally, it was the 8th largest, from a dollar standpoint, the 8th largest amount in the country. And but important to note here, over 80% of our members and businesses that responded to our surveys indicated that they felt that the Paycheck Protection Program has not and will not be sufficient in sustaining business operations. So, you know, as we begin looking forward, the majority of our members, 84%, support the phased-in approach in reopening our economy. When we ask employers what are they going to need to reopen, they talk about the modifications to the Governor Whitmer's Stay Home, Stay Safe and emergency executive orders, guidance on how to keep employees and customers safe and how to rebuild that trust as well. Access to the PPE for all employees. And I think that, again, we hear from medical professionals talking about being very cautious in that and not having businesses run out and continue in buying up the supplies of that, as our healthcare professionals are going to need to continue that as they continue to treat patients, then that access to capital and cash again. So, so how do we begin this reopening? Well, you know what, I think you've seen it with the governor's recent announcements on reopening some of the outdoor related businesses a week ago. Her press conference this afternoon announcing the sort of safe, bringing back on construction and certain aspects of real estate. And I think what we all anticipate announcements coming up here in the next couple of weeks regarding auto manufacturing and supply chains, which we all know are very, very critical and important to our state's economy. Her Michigan, the Economic Recovery Council, earlier this week announced the phased-in approach. We are in Region 5, which includes not only our Tri-County region of Ingham, Eaton, and Clinton County, but it also includes Gratiot, Isabella, and Shiawassee counties in our region as well. And then earlier this week, we launched and hosted our first relaunch Greater Lansing Economic Rehabilitation Task Force. This effort includes business leaders, community education, government, healthcare professionals, and overall subject matter experts. And this includes Ingham County Health Department Director Linda Vail, Dr. Peter Graham, who is the Chief Medical Officer with Physicians Health Plan, and Dr. Farhan Bhatti with Carefree Medical and Dental. The goals of this effort, as we talked, is how do we build a smart relaunch strategy for our region? And that is when we open, how do we remain open? How do we relaunch with the same energy and sustaining the economic growth and the climate we had before? We still have over $3 billion in economic development and projects occurring throughout our 3-county region. And how do we sustain that and keep that same energy going? I think we have to identify those challenges and build actionable, strategies around that. Developing this sort of resource guide, kind of what we've identified and outlined as being this blueprint for restarting business operations. And then the employee communications, and that is, again, how do we prioritize the safety and well-being of our employees and customers? And part of that is rebuilding the trust. I mean, why and how are customers going to access your business? And in many instances, do you need to have that type of access as well? And then the other big piece here, and it's something that came out of our first meeting, is the whole education piece. And within the education piece, you start thinking, downstream a little bit. There is the childcare and the lack of childcare and the impact that has on our workforce, and then the public transportation issues as well. So, and we'll have more information in the coming week on the relaunch Greater Lansing effort. But we're looking at this as being a real coordinated, strategic, regional approach to reopening our economy. So, again, I thank you for the opportunity to be here, and I'd be happy to answer any questions you may have. So, thank you, Linda.
Thanks, Tim.
All right, we are open for questions now. I currently don't have anyone in the queue. Megan Banta, go ahead.
So the new death last night and the one today, what can you tell us about age, gender, if they'd been in the hospital?
They were both in the hospital. I believe both women, both older. Let's see. I think one was in her 80s, one was in her 70s. I don't have all my stuff in front of me right now, but and both with some fairly serious underlying medical conditions. So.
All right, Kyle Kaminsky.
I just wanted to double check the cumulative totals for cases and deaths at the moment. I didn't catch that.
I believe it was 485 and 13. Hang on just a minute. I will verify that I am not wrong. I know the 13 is correct. 485, yep.
And the number recovered?
The number recovered is 155.
Thank you.
Megan.
Tim, do you know if there there a significant number of local businesses based on your guys' surveys that have had to close because of economic stress during the pandemic?
Megan, there most definitely are, but I don't know that I'm able to give you an exact percentage. But I think certainly a number of businesses, especially when they're not deemed as essential employers, have ceased operations. Yes.
Okay, thank you.
I don't have any questions in the queue. If you have a question, please go ahead.
It's a quiet group today, Tim. Oh, here's Dave Ackerley. You can always count on Dave Ackerley.
Hey.
There's always one more question. Tim, I have
Always.
one here for you. You mentioned here the number of personal paycheck protection loans where Michigan was. I think you said, correct me, we were in the top 10 states for getting those. Is that right?
We were, from a dollar amount, Dave. Yes, we had about $10.8 billion in 10.3 billion. I'm sorry, $10.3 billion in loan value.
Okay, thank you. Today, Lansing City Council Vice President Adam Hussein was online on social media with a kind of a long and an angry message where he said he went to have a Southwest Lansing meeting, and the number of people, he was appalled at the number of businesses who were preparing to declare bankruptcy and cash in that they were not able to access. And he didn't have, it seemed his takeaway was he had no idea that the problem here locally with small business was that big. Is there a disconnect right now between some aspect of business and these lifelines and others, or are more through their banks well connected? Is it about outreach? And do you see that problem and feel it the same way that he reacted to today?
Well, I think that there's most definitely been that discrepancy, Dave, and I think that was identified pretty loud and clear after the first phase, the first $350 billion. And I know when we surveyed and talked to our financial institutions here in the 3-county region, they all, I think, expressed concern over not being able to get to what I kind of deem the smallest of small business. I mean, you have to remember the SBA definition for small business is 500 employees and less. 500 employees in our region, we consider that really a medium to, in some instances, a large business, right?
Right.
So when you get into Southwest Lansing and Adam Hussein's district that he serves, those are truly the smallest of small. So you consider those, a lot of people call them the mom and pops, and I know that there have been serious challenges with what and how those folks have been able to access the loan program. So Disappointing, I have not heard anybody, at least I have not had any direct conversations with any businesses that have just said, you know what, we're throwing in the towel, we're just closing the door. However, that's going to be something downstream we're not going to know. I mean, we have 1,100 members that we represent here throughout the 3-county region. And I would say 80% of them are, these small businesses, less than 100 employees. And so what is that going to look like for them as they emerge from here? Are we expecting 25% of those to not be in business? We don't know yet, but really the impact. And one more piece and I'll stop, but I do know that in phase 2 with this, the feds did and SBA did open up new lending opportunities for the non-traditional financial institutions and non-traditional SBA lenders. I cannot speak to the success of that and how they've reached some of those community groups.
All right, thanks, Tim.
Rachel Sweet.
Hello. All right, I just have a question in regards to, hold on one second. In regards to the farm from last week that we talked about, do you know how many people in Ingham County were connected to the farm and how many have recovered possibly?
I don't have a recovery number on that. Last I knew, and this was yesterday, so I haven't gotten numbers from today, we had 23 total that were associated with it. However, I believe 7 of those were household contacts. They're not actually employees of the farm. So they are contacts to those employees. So I think to a large extent, the outbreak is new enough that we don't have people far enough out in their symptomology for us to consider them recovered. In addition to that, they are gradually changing the guidance, even at the state level, about what, not the state level, the federal level, about how long people need to be isolated or in quarantine once they have symptoms, and they've extended that. Remember, it used to be 7 days after symptoms started or 3 days after they ended. That's been pushed out to 10 days plus 72 hours because of the viral shedding period. So it's going to take us some time to get people moved into that recovered category now that we've extended another 3 days. And keep in mind that the state definition of recovered is 30 days after onset of symptoms and still alive.
Okay.
Because they don't really, they don't have all the way to call. We call people and actually find out when their symptoms ended and move them over to our recovered group before the state would. And of course, we wouldn't move somebody over to our recovered group if they're 30 days into this illness and still in the hospital.